Hey, good morning, friends. April here with Medwell Health and Wellness. I am so excited to kick off our new fall campaign with my partner in crime, Emily Waxman, our director of community outreach, blah, blah. See, I'm already starting technology here.
It's been a while.
It's been a while. So it's good to be back with all of you friends. Just some housekeeping to get out of the way before we get started and introduce our very awesome guest today. We are streaming actually to Florida, and we want to let you know that we're thinking of you if you are catching this. To all of our friends down there, we hope that you are safe and that you weathered the storm okay. We are streaming to our Facebook page here in Massachusetts, as well as our YouTube channel. Please feel free to leave a comment, ask a question as we go along. And if you are catching the replay, feel free to drop a question. We will absolutely get back to you. So as we kind of kick off our series. We are a little bit ahead, but we are honoring and breast cancer awareness comes up in October. So, one of the things as part of this series, we'll be talking about talking with different partners and patients that have experienced cancer, talking a little bit about their journey, and also how medical cannabis has really helped them along their journey in their experience and their health and wellness. So at the end of the day, you wouldn't believe the guests, and especially our guest today, just kicking cancer's ass. It's a journey, and it's not a sprint, it's a marathon. And so not only are we celebrating these warriors and these rock stars, but our goal is to educate you and share a little bit more about how medical cannabis can make a huge difference in the journey. So again, I'm going to do some introductions here. I have Emily Waxman, our Director of Community Outreach. She's here with us today, and I'm really excited. We're bringing back our friend Nicole DiMonda-Brambila from Grace Health and Wellness Cannabis. How are you, Nicole?
I'm doing well. Thank you. I'm really, really excited to be here. Thanks. Yeah.
Awesome. So friends, today our concentration of our story is about the story of perseverance. Nicole has, I'm going to let her share a little bit about her story, but really you will be amazed at kind of her journey through cancer and the use of medical cannabis, and also just really how she has now moved on, and she's sharing her messaging and sharing her journey and kind of helping others. So it's amazing. So let's get started. I'm going to first start. Emily, tell a little bit about you and what you're doing in the community as we ramp into the fall here. Kind of summer's over, vacation's over, and we're back at it in the community.
Yes, you said it, April. Vacation is over. And so now it is time to get back out there and do education to everyone out there that has questions about how medical cannabis can help you. For patients that are out there, we are always still here to be able to explain to you what more is out there to help you, maybe get you some information that you've been curious about. And so that's why we are always out there, April, right? Making sure we get education to our community and to be able to have guests like Nicole, who we are so blessed to be able to speak to today. It is just an absolute pleasure to see you again, Nicole, and speak to you. Just an honor. And I am so thrilled to be able to have this series that we're going to be doing for breast cancer. We've been talking about doing this for a while, I think, April. So now that it's actually here, I am so excited. I wore my pink today to make sure I'm in full breast cancer.
Oh, you did good.
So, but it is so great to be here. Definitely look for me at the dispensaries. I've got a lot of table events, fun things to be able to talk to patients and non-patients alike. So if you see me, make sure you stop by and say hello. And I will turn this over back to you, April, so we can start talking to Nicole and hear her amazing story.
All right, Nicole. We would love to introduce yourself, and then if you're so inclined and what you're comfortable in sharing, kind of your journey that with breast cancer, and kind of let's start there. So I'm going to let you take it away, my friend. And as with live, friends, there is some delays, and even the person
Internet
live
glitches
has some
sometimes.
hiccups. So, all right. So I think she's going to be logging back in. So, all right. Well, while we're waiting for Nicole, Emily, what's up next? Where can we find you in the community? I know you have some things coming up.
Absolutely. So I have the pleasure and the honor of heading to Air Wellness tomorrow in Needham. They are a medical-only facility, so you can stop by there if you're a patient and come say hello. It is always an absolute pleasure being able to work with that dispensary. They are a phenomenal group with amazing products. So that is where you can find me tomorrow. I'll be there, I believe, 10 to 2. So definitely stop by if you're in the area there. And then, we've got a lot of fun events, I think, coming up for October. So between what I'll be doing as far as table events and then with Unscripted, we have not only my fun event for tomorrow, but then next week, we've got Nicole again.
Okay, you guys, so sorry.
Oh, no worries. This is
No
is
worries.
the live transition. Internet, we rely heavily on this dang thing, but at the end of the day, that's what makes it human, right? Because we're real people.
Absolutely.
It happens to everybody. All right, my friend, if you are comfortable in sharing your story, introduce yourself. We would love to hear from you.
Absolutely. Thank you. My name is Nicole. And in 2018, I was diagnosed with stage 4 metastatic breast cancer. This was actually out in California. At the time, I was living in California. I'm from New York originally, and my husband and I had a small delivery service out there. It was, very successful. We were having a lot of fun. We were also providing a lot of education, because what we realized is a lot of the information that was out there was not as comprehensive as it needed to be. And we started getting phone calls from people who are actually very sick. And we decided to drop all of the recreational, and we went right into the medical. And we started helping people with cancer, children with autism. And then, as I was explaining, in 2018, ironically, I was diagnosed. So all of that information, all of that research that we had done, we now brought to my case. And we began to actually implement all of the proprietary blends of cannabis. I also use psilocybin during the treatment as well. And
Sorry.
in within a very short period of time, 5 months, after only 3 chemo rounds, there was no evidence of disease. And that was pretty miraculous, because, metastatic cancer is kind of an interesting, it's an interesting situation, because I'll never be in remission the way in which, other cancer patients would be. But the most important thing is going through that healing process. And so the cannabis allowed me to really go through, as I said, that healing process. I was able to eat, I was able to sleep, especially even during the chemo. And as I said, after 5 months and 3 chemo rounds, there was no metabolic activity, and it was pretty much a miraculous situation which occurred. And the doctors they were amazed. So. Yeah.
That's amazing. That's amazing. You know what? Do you mind me asking you? So obviously, I'm sure you've seen the news where Katie Couric has talked about her breast cancer diagnosis. I'm not sure if you've seen that. So I guess I would love, if you don't mind sharing, kind of how was it a routine mammogram that you found it, or was it something you weren't feeling well?
Oh, that's an excellent question. There were no symptoms, and that's why I'm a big advocate for women even before the age, because we're told at the age of 50 we're supposed to be getting mammograms. Well, statistically it doesn't match, because what we're finding is the age that women are now being diagnosed with breast cancer is younger and younger, and I'm talking about astronomically. The percentage has increased among women between the ages of 25 and 35. So the system is off for us completely. And basically what ended up happening was I was washing our dog in the tub, fell backwards, hurt my shoulder, The following morning, I woke up. I was in excruciating pain. I couldn't lift my head. And so went to the emergency room, and they said it's probably because of the fall. They pumped me up with painkillers and muscle relaxants and sent me home. 2 days later, my husband was helping me change. And on the side, there was actually a much better view, if you will, of this mass. If you looked straight on, you couldn't really see it. And the breast on the top portion, you couldn't feel it. And so, he said, I see a lump. Okay, what is this? I went to the doctor and came back, and we all thought it was a fatty deposit. And until, I went back for the appointment, and they just said, we're pretty sure that you have cancer and you're going to have to come back for a biopsy. This was in California, and I went, and lo and behold, they initially diagnosed me as stage 1, stage 2. And then what happened was, my family was back on the East Coast. My mom was like, come home immediately. I went to Sloan Kettering, and then found out it was actually stage 4. It had metastasized into my neck. So I had 8-hour spinal surgery. So those metastases were actually in the neck and the liver, in my hip. And so, yeah, the diagnosis was not very positive at the time.
Wow. And now, were you, had you had mammograms before that, or this was because of where you were? It was I know states vary in ages, right? Which is frustrating.
Again, it's just very interesting. So when I got my first mammogram done, I was actually 41. But at that time, and this was like, 12 years ago now, right? At that time, the interesting thing is insurance companies said this was a good age for women to get mammograms. However, that changed and the age switched to 50. So at 45, when I was told to go back, they said, oh, don't worry about it. It changed. You don't have to come in. So if my husband did not this mass, if we hadn't discovered this, I would not be here. So as far as what they're saying in terms of getting tested, it's just all wrong. It's all wrong. And I implore women constantly, and men, by the way, because one of the other things that we're finding is a tremendous increase in breast cancer among men, but they don't want to talk about it.
Of course. Yeah. That makes sense. I mean, I'm in the state of Connecticut, and I know you have family here. So Connecticut actually is I'm very lucky. They're pretty good advocates of starting at 40. The insurance pays for it. It's actually a law that they have to provide a mammogram to, a woman annually. So, which has been great. And I know, it's one of those things like Katie Kirk was even saying, and I don't mean to use her, but because it's on the TV the past 24 hours, right? That, and unfortunately the hurricane. But she was saying she waited 6 months, where I'm 49 and I have a history of breast cancer in my family, but after menopause, like my grandmothers were in their 70s. But I'm considered high risk. So I go every 6 months. Like I actually have to go for an MRI. I have an MRI once a year. I have mammograms. It's very stressful, as I'm sure that same when you go get your checkup. So now, do you have to go every few months, or how does that kind of work at this stage of the game where you're at?
Well, for myself, I have an infusion that I have to go for every 3 weeks. So that's mandatory. That's part of my treatment. But the testing usually is, initially was every 3 months. Now I'm at every 6 months. So that's cool.
Great.
Very happy about that. Yeah.
That's great.
But a lot of it is just monitoring because of the type of cancer. And I just wanted to touch on a very important point that you mentioned, April, which is, the idea of knowing the genetic makeup, knowing your background, because it's very interesting what we've also finding what's happening now. I know that we have always been told about our backgrounds in the genetic testing and how important that is. But one of the things that they're also determining now is that doesn't have a lot to do with the actual development of cancer in the system. And so what we recommend now is for people to go for a certain type of testing. that helps with understanding your own genetic makeup, your own genetic background. And this way you have a much better idea of what's actually going on, if that makes sense.
Right. Is that the BRCA gene
Yes,
testing?
that's
Yeah.
definitely one of them.
And that's very scary. I actually have been recommended to go do it, and I have not done it yet because I've also learned, just like with laws in different states of mammograms, that once you do your BRCA gene genetic testing, it actually becomes pre-existing conditions to other things like life insurance policies and things like that. So where I had one of my best friends, her mom died of breast cancer. Her sisters had it. She has the gene, but she didn't recognize that before she got the BRCA gene testing. So that's kind of eliminated some things. And that's the one thing. So I don't know. But yeah, testing is huge, I'm sure.
Yeah. And, it's very scary. It's very overwhelming because there are several things that are going on. One is, just the sole fact that you get this diagnosis is enough. Coping through that. And again, I tell people all the time, this is not something that just affects me. That doesn't affect just the individual. You're talking about anybody who's connected to that person, family and friends. Once you hear that, it's a game changer. And, what's very important to realize is you have to ask questions. I tell women all the time, ask your doctor questions, find out about the testing, do some research on your own. Don't just settle for what is being told is a protocol for you, because that protocol, yes, is based on statistics, and I understand its place, but everyone still is an individual. And that's for women to recognize that, for people to recognize that, because we can apply the protocol, but we also have to understand that the questions are going to be asked to adjust what's necessary for the needs of the patient. And that's really not being done. That's what we're trying to change.
Excellent advice.
Yeah.
So let's talk a little bit about, you shared a great article with Emily and kind of the case, it's really kind of like a case study. And I'm going to drop a link here in the chat here. Let's talk a little bit about kind of when you decided to look at using medicinal cannabis. And I know in California where you started was a little bit different. So medicinal cannabis is part of your therapy regimen.
Yeah. Great question. So I was not a cannabis user prior to this. My background is in finance and also in teaching. I was a special education teacher. So I was, like I said, not a great advocate because of obvious reasons. Most of the time in the classroom, that's not what you're looking for. But for myself, what ended up happening is that because of the experience we had with the delivery service, we had started making our own proprietary blends, our own formulations for our patients. And thankfully, that research we immediately implemented into my therapy. So we actually began a cannabis regimen prior to my chemo. It was an interesting journey because of the levels that I was on and that I had to take. But it was definitely worth it. And one of the most important things is allowing the cannabis to aid in the healing process. So when I had the chemo, or when I wasn't feeling well, or when I couldn't eat for a couple of days, the important thing was having the cannabis, allowing myself to eat, and even with sleeping, because those are the two most important points. So.
Well, yeah, because it's like if you're not sleeping, then you can't heal. So it's, extremely important to be able to get that rest.
Yes. Yeah, it really was. So that was again a game changer, because you, on the one hand, yes, you have these debilitating effects from the chemo, and there's no denying that. But the cannabis just allows you to walk through that without the fear, without the anxiety. It allows you to have a little bit of comfort, physically, emotionally, mentally, even spiritually. So
Because I would imagine that besides having to deal with this diagnosis and then go through this chemo, which I've heard just in itself just completely takes the life out of you. It's got to be very scary. I think one thing that I read in that article that stuck so much with me, Nicole, was when you got your diagnosis, you said, how am I going to tell my mom?
That was,
And that it just resonated so much with me because first, I mean, it just shows what an amazing human being you are, that you're thinking about your mom as you just got this diagnosis. But, it's so true. Like I was thinking, geez, like how would I tell my children? How would I tell my own mom? It's very frightening to think of all of those really scary things that are associated with a diagnosis such as this. So the fact that the cannabis can also kind of just take the edge off of all those thoughts that I'm sure were going through your head at the time is really fantastic, because I'm sure it then allowed you to focus on yourself and your healing and what you need to do instead of worrying about some things that sometimes are just, we can't control,
That's again, just such an excellent point, because from the physical aspect, we know chemo is a rough road. We know radiation is a rough road. We have all those facts, together.
Yeah.
But the harder part, the physical stuff is hard. I'm absolutely not denying that. But the harder part is everything that you're explaining, everything that you explained, Emily, which is how this is affecting not only, you, but everybody else around you. And the steps that should also be taken during that process as well. We don't talk about it enough, because, we just have to get the cancer. We want to get the cancer. We want to, fight. And I tell people, again, one of the most important things is you have to be patient with yourself. Like, now is the time to learn self-care. Now is the time to really understand that you have to cut everything out and really start focusing on yourself, because that healing has to come from within. Totally. And for myself, just going back to the point that you had mentioned, one of the reasons why I had said that is about my mom was because we had just she had just lost her mom 2 years after. She had just lost her husband, and then 6 months after that, she had lost her brother. And I was like, okay, this is wonderful. Like, how do you tell somebody this? And these are the things I really believe we also have to have conversations about, because the fear is so debilitating.
Yeah.
That you can go in and the chemo can kill the cancer, and you come out of that on the other side of I don't know what. And I always use the example. I don't know if you've ever seen the movie of The Shawshank Redemption, when Tim Robbins, he climbed, he travels through that tunnel only to come out clean on the other end, and that's what you're looking for. And the thing is, if we're not talking about it, if we're not expressing what's happening inside, because women especially, we try to keep everything together all the time. That's part of the healing process. It has to be expressed, and we have to learn how to start speaking about this.
Wow. I so agree with that. I think as women, we put so much pressure on ourselves to get it all done, and we put our self-care really at the bottom of the totem pole. And when you're dealing with something like this, it's I'm sure it's a learned process that you have to, really focus on making sure that your needs are coming above everyone else's. But I think that's definitely not the norm for us. So that's its own journey in itself, I would imagine.
Yeah. And it's a very interesting thing, because we have this concept, that we have to now be tough, even tougher than we were before. That whole boss attitude, which by the way, I think is wonderful, but there's a place for it. I don't think that that's something that has to be executed 24/7. And what I also discovered is pre-cancer, pre-diagnosis, my ego was completely fixated on that whole, boss lady thing, and we're going to do this. And I really became, my strength came from going through this process. I became the person that I am now, which I believe is the strongest I've ever been because of going through this process and learning about self-care and learning about how to appreciate myself, because most of us really don't, you know.
Agreed.
Which that is a wonderful lead into talking a little bit about Grace Health and Wellness.
Yes. Yeah. So Grace Health and Wellness is a company. It's our company, myself and my husband. We actually began, as I was explaining, out in California, and we started with proprietary blends to actually help people with cancer, critical ailments, children with epilepsy, and we were successful, which was wonderful because we were seeing a lot of change. We started with education. Then I got diagnosed, and now we use those proprietary blends. They're the same formulations that I take. We provide those same medicines for people, anybody who has questions, about any kind of critical ailments. We have a state-certified lab in our home in Connecticut. We're in Weston, Connecticut, and we're just happy to be able to make medicine for people to keep them healthy and make them better.
So great.
That's awesome. And so, friends, I did drop the link in the chat here. Did you update your website? It looks like you did some updating since the last time we chatted. It looks
good. We finally found a competent computer person, if you will. So that's a little bit of a hassle, but we're good now. But yeah, we thankfully updated it, and we have our article that's on there if anybody is interested in finding out information. There's also information on there, just educational information. We have a cannabis library talking about how to utilize cannabis successfully. Dosing is also a really big thing for us. So yeah, please check us out. Grace Health and Wellness. It's gracehw.com. Yeah.
And why don't you briefly talk a little bit about, you do some coaching or consultation sessions with people?
Yes, we actually we do 30-minute, 60-minute, and also life coaching, which is available, because one of the things that we know is it's not just about utilizing the cannabis and the treatment. We also incorporate and speak to our patients about diet, environmental issues, some activities that they could be doing that can help them, like acupuncture. So we'll go over an entire intake with the person. We go over the medications that they're taking to really give them a comprehensive plan as to how the cannabis can help, if they have questions about psilocybin as well. So yeah, we want people to just heal and get better. So,
I think it's so amazing too. I'm sorry, April, that Nicole, that you offer that, because I think there's just, there's really not, it's not like there's a book or a guide that right. says, start with this and take this. And like you were saying, we are all made up differently. So what you take and then what I take is completely different. So it's just so phenomenal that patients can have that conversation with you. So at least it gives them a starting point and a little bit of a guide as to where to go, because that is just part of the whole stress, I would imagine, is just not where do I go? What do I take? How do I do this?
Right.
That's so important. We actually engage in, we practice something which is relatively new within medicine, which is called polypharmacology. And what that basically means is we no longer look at a person and having this one disease and there's one tool to fix it. Polypharmacology now steps in and says, you know what? Here is that individual. Everyone is an individual. We need to acquire like a set of tools. What are the tools that we need in this toolbox for this individual? And that's where the polypharmacology steps in, so that we now can say, we not only need cannabis, but we also need turmeric. We also, for whatever reason, need rosemary, and this person has to have a smoothie. and this person has to exercise certain times during the day. And so again, we're looking at the entire person, mind, body, and soul. We're not leaving anything out because you can't. When you're battling something like this, you just can't. You don't have any wiggle room, so we want to get it all in there at once. So,
if you were to give one ending piece of advice today for somebody that just got a diagnosis of breast cancer, they were recently diagnosed, what would your kind of, from your experience, what would that piece of advice be?
Kick and scream as much as you want. Kick and scream for a day, kick and scream for a month. Don't let it hold you down. Fight and know that there is support that can be found. And be okay with the illness, be okay with the diagnosis, but take your time with it. Don't listen to people that have, that tell you it's time to get up, you're going to have to deal with this. No, everything at your own pace. And this is the opportunity for you to learn how to love yourself the right way.
What a great piece of
Wonderful
wisdom.
advice. So true.
And on that note, my friends, Nicole, thank you so much for sharing your story with us and all of your knowledge that you've shared. And obviously, we would love to have you back in the future. And and we glad you're feeling well, and hopefully you continue to feel well and share your grace.
Such an inspiration, Nicole. Yeah. Thank you so much. Really, just an inspiration to all. Thank you for all that you've done, for the community and that you continue to do. We're truly blessed to have someone like you here. So
thank you. And thank you for the opportunity. I appreciate it greatly. I'm very grateful. Thank you.
Yeah.
And friends, to learn more about Nicole and Grace Health and Wellness, go to gracehw.com. And if you have questions about getting your medical cannabis card, whether you're in Florida or in Massachusetts, you can go to medwellhealth.net. We also have some information on kind of understanding the process and also what you need to certify to get your medical cannabis card. Emily, thank you so much for your time today. This was wonderful. And friends, we will be back next Thursday, same time. We have some great partners lined up. Like I said, we have some great partners, some patients that are going to come on, and we're going to be talking about how these amazing humans and organizations are helping or are kicking cancer's ass, friends. So have a great day. If you are catching the replay, please leave a comment. Let us know that you're here or question, and we'll be absolutely sure to get back to you. Take care, friends.
Bye. Thank you.